Hello folks, welcome to the 34th video of the Regal Wellness series. Today we're going to be talking about the warning signs of a heart attack. But before we get to that, let's talk about the warning signs of heart disease. And we got three main ones we're going to talk about. And folks, we're talking about these warning signs of heart disease because unfortunately if you pay attention to these warning signs, maybe you can stop a heart attack from happening. Our first one is chest pain or discomfort. You notice during physical activity or emotional stress, but it goes away when you rest up. Another one is unusual tiredness. You might think, geez, last month I was doing the same activities, and today I'm really tired, I'm really fatigued. So that's another sign. And our third warning sign is shortness of breath during normal activities. So for instance, you go to the grocery store, you park, you walk into the store, and by the time you get to the store, you're huffing and puffing. That's another warning sign. So if you have any of these, we recommend that you see your Regal doctor or your Lakeside doctor for a full workup, and they might ask you to go to see a specialist, a heart specialist, which is what? You're right, cardiologist. Now let's talk about the warning signs of a heart attack. And there's no good thing about a heart attack, but one positive thing about a heart attack, they usually come on slowly. So you can. So if you know the warning signs, you could use those to your advantage. Our first warning signs, and the number one warning sign, is pain or discomfort in the center of your chest. And this may stop after a while, or it may return, or it may just continue. And what you'll feel extreme pressure. You'll feel like a squeezing, a fullness, that kind of feeling you're going to get in there. Another sign is discomfort in other areas of your body. It could be one arm, the other arm. It could be both arms. It could be your back. It could be your neck. It could be your jaw. Even in your stomach, you could have these discomfort feelings. Another one is shortness of breath, and this can occur without chest pain. Another one, our other sign is cold sweat, nausea, and real lightheadedness. You feel faint. So these are all signs of a heart attack. Now, symptoms may vary between men and women, but still the number one sign is chest pain for both men and women. But women are more likely than men to experience some of the other symptoms, particularly shortness of breath, nausea, vomiting, and pain in the jaw and the back of their neck. So these are more susceptible to women to have these symptoms. But remember, folks, if you have any of these symptoms, call 911 immediately. The faster you call, the faster help is going to come. And don't hesitate. Call right away. You want that help. Because even if you know CPR, we'll talk about CPR at the very end, but even if you know CPR, you can only do that for so long. So remember, get that call in immediately. Okay. So then this brings us to COVID-19. And you said, oh, what's COVID-19? I thought we were talking about heart problems. Well, COVID-19 is obviously a respiratory disease, but if the lung and the respiratory relates to what? Lungs, right, relates to your lungs. Now, if your lungs aren't working correctly, they're not working 100%, what's going to have to work harder? You bet, your heart. Your heart's going to have to work harder. And COVID has been also linked to inflammation in the blood vessels, and if you have inflammation in your blood vessels, what's going to go up, right? Your blood pressure, your heart rate's going to go up, and you don't want that to happen. And also, COVID-19 has been linked to inflammation of the heart muscle. And heart muscle, another term for that, inflammation of the heart muscle, the myocarditis. And myocarditis, you're hearing a lot about that lately. And this myocarditis is not only going to affect the heart muscle, but it's going to affect the electrical system in your heart. And the electrical system is going to be your AV node or your SA node, the sinoatrial or atrioventricular nodes. And that kind of regulates, gives you that nice pulse that you get the beat, relax, your heart beats, relax. If that gets thrown out of whack, that could cause a rapid heart rate. You can get a little fluttering, or you can get a skip beat. And that's something you don't want. You hear that term arrhythmia, and that's something that happens arrhythmia, so that you're not getting the correct beat, and that could lead to a lot of problems with your heart. So these are just some of the things we wanted to kind of link that into COVID-19, because obviously COVID-19 is the news for the year. But we just wanted to go over. Hopefully you remember these things. And also, like we talked about, I said we're going to talk about CPR. If you're we really suggest you take a CPR class, because most of the times you give CPR, if it's to someone you love, someone you know, it's going to be someone close by you that you're going to give the CPR class to. And we have a gentleman that takes our classes. He teaches an outstanding CPR class, and a young lady that I used to work with, she has CPR classes going on right now. So if you'd like that information, just contact me, and we'll send you the information you need. But again, we want to thank you so much for joining us today. Remember, stay strong, stay safe, and be happy. See you next week.